My name is Arissa Falat. I'm a PharmD JD from Maryland in the United States. I currently work as a health policy analyst at the Maryland Prescription Drug Affordability Board. Our staff and board are tasked with making drugs more affordable for Maryland patients. So currently I'm involved in a lot of health policy research and work and implementing a few policies in the state of Maryland that will expand access to medications. The Maryland Prescription Drug Affordability Board and staff are currently conducting cost reviews on key medications that may represent affordability challenges for Maryland residents. These drugs are often presenting challenges for the nation as a whole and other states. The Maryland Prescription Drug Affordability Board is engaged in pretty revolutionary work right now with the authority to implement upper payment limits for insurance plans for these key medications. So the Maryland Prescription Drug Affordability Board recently got more expanded authority to implement upper payment limits for payers in the state of Maryland for key drugs that have been selected and reviewed. The upper payment limit represents a tool that may be used by the state of Maryland in the future, as well as serve as a model for other states to implement these upper payment limits and cost controlling mechanisms in hopes that increased medication access as well as likely better affordability will be achieved for residents and for health plans in the state. Something that I was involved in the last few months was passing a bill to expand the Maryland Prescription Drug Repository program. What this is a program designed to help redistribute donated medications to Maryland residents. So we have partnered with a company that works between many states to help increase access to these donated medications to provide these for low cost for Maryland patients. For me, in the state of Maryland, I am constantly seeing just how fragmented the health system is in the United States, among states and the whole nation. It is so fragmented that it's very difficult to even understand all of the issues facing prescription drug affordability and other healthcare inequalities in our country. I think that discussions like the ones occurring this week in the Summer Academy here at the Brocher Foundation are very critical to improving some of these situations facing the world as a whole. It's very important to have this discourse between researchers in different countries to help identify the issues that may be facing some countries more than others, help discuss the challenges that different countries face, and learn from everybody's different perspectives. I think healthcare is such an interdisciplinary problem that really requires intersectional analysis and collaboration among people that aren't like-minded but are like-motivated to solving some of these issues. And I think that all the discourse that is happening this week is really eye-opening and really helps everybody that is involved and everybody that is in attendance here learn new perspectives and learn how to identify issues that they might not have even noticed before. As we face these challenges, it gives me hope that on an individual level, all of the providers that I know, all of the students that are currently in graduate school, all of the researchers that I have interacted with, we all really have the same goal in mind. I think that healthcare systems as a whole may get a lot of negativity, but it's very important and reassuring for me to see that each individual provider and person that I work with on a daily basis does generally have the same goal in mind, to increase the well-being of the community, to increase access to medications and healthcare. And it's very reassuring to me to see the young researchers that are here, as well as the more established researchers, all working towards the same goal at a small level. And it's really at the small scale work that it can translate into something larger.